All right, good morning. My name is Emily Muth, and I completed my practicum at the Fort Smith Health and Social Services Authority in Fort Smith, Northwest Territories. Fort Smith is a community of about 2,400 people, and it's located on the South Slave region of the Northwest Territories. There are several health issues that are of concern in the territory. One that is of particular concern is diabetes, and with that, the high prevalence of many of the risk factors associated with diabetes. Currently, less than half the adult population in the territory report getting enough physical activity to maintain or improve their health. Adults in the territory report a lower consumption of fruits and vegetables compared to other Canadians. And one of the biggest ones is that 63% of adults over the age of 12 are classified as overweight or obese based on self-reported measures. In Fort Smith, where I completed my practicum, diabetes is one of the most pressing concerns to the public health department. In 2009, the prevalence rate was 7.2%. However, today it's actually believed to be closer to 10% of the population. With the high prevalence of diabetes, as well as the risk factors associated with the disease, the department offers a wide range of services to individuals who currently are diagnosed with diabetes. One area that's been identified as a need is the upstream prevention of risk factors. In 2013, the local high school, PWK High School, created a fitness center on campus, and currently all grade 7, 8, 9 students participate in a 1-hour fitness class every day. The public health department approached the high school to see if there was interest in implementing a healthy eating program in the fitness class, and the high school is very interested, and in 2015, in the fall, we're going to be implementing the Craving Change program at the high school. Craving Change is the most extensively used program in Canada that aims to address problematic eating through the use of cognitive behavioral approaches. It aims to assist participants with gaining a better understanding of the thoughts, feelings, and emotions that influence their eating habits. It is not yet validated for use within a student or youth population. However, based on feedback from the program creators, program facilitators, and previous participants, it was decided to implement the program at the high school and conduct a process evaluation in order to gain a better understanding of the program. So I did 2 deliverables. The first was an implementation plan, and the second was a framework for the process evaluation. I should also mention that before this whole decision was made, we did do a review of the literature, and there is research that supports the use of programs using cognitive behavioral approaches to address and/or avoid obesity within student populations. So our planning process followed this guide developed by Saunders, Joshi, and Evans in 2005. This guide is extremely well suited for standalone programs that take place within a specific setting. So in our case, this was in the high school. The 6 steps are, the first one is to describe the program. This is then followed by describing complete and acceptable delivery of program elements. Steps 3, 4, and 5 are considered fluid, and they kind of involve researching potential questions, methods, and then reflecting on the resources that are available to actually conduct the research. So today I'm just going to speak specifically about steps 1, 2, and 6. This is a small portion of the logic model that we created for the Craving Change program. The overall goal is that students will utilize the resources provided to them in the program in order to address and/or avoid problematic eating in their lives, ultimately resulting in a decrease in the rate of diabetes in this population as they move into adulthood. All grade 9 students will be participating in the Craving Change program in the fall, and the program consists of 6 1-hour sessions that will take place between October and November. Our output, or the whole focus of the evaluation, is to gain a better understanding of the program within a student population. Okay, so this is complete and acceptable delivery, and it's a little hard to read, but I'm just gonna go over the 4 elements listed on the side. So the 4 program elements that we will be evaluating are fidelity, which is the degree to which a program is implemented as planned; dose delivered, which is the degree to which the modules and activities within a program are implemented as planned; dose received, the degree to which participants use modules and activities; and finally, reach, which is the degree to which the intended audience, the grade 9 students, participate in program. For each of the measures, we listed a measure of both complete and acceptable delivery, and I'll just give you one example on the next slide. So for dose received, the Craving Change program consists of 6 modules. A complete delivery would involve all students participating in 100% of the modules, while an acceptable delivery level was set at 80%. In the Northwest Territories, the average attendance rate for students in regional centers is 80%, so that's why we selected that cutoff. Once we determined complete and acceptable delivery, we brainstormed potential questions and finalized a list of 9 evaluation questions, which range from to what extent has the program implemented as planned, to what were some of the potential barriers and facilitators to implementing the program. The framework that I created provides a guide for the evaluation of the program, and it contains all the tools and instruments needed for data collection, storage, and analysis. The setting, as I mentioned, is at PWK High School, which is the only high school in the community. All grade 9 students will be participating in the program and also in the evaluation. And 2 of the members of the public health team will be responsible for both implementing the program and will also be responsible for the evaluation. We'll be using a total of 7 tools for the evaluation. 5 of these I created uniquely for this project. One is the Weight Efficacy Lifestyle Questionnaire, which will be used to address or assess participants' self-efficacy when it comes to eating. We'll be using this at the beginning and again at the end of the program. And the final tool is the Participant Program Evaluation, which comes with the material in the Craving Change program. We're using a combination of both quantitative and qualitative methods, including open-ended surveys, questionnaires, and in-depth kind of interviews with the facilitators at the end of the program. It serves both formative and summative purposes, so throughout the actual evaluation and implementation of the program, we will be making changes to the program to make sure that it is meeting the needs of the student population. And the summative purposes are kind of at the end to make a decision whether or not this program should be implemented again in the future with this audience. So the complete and acceptable delivery that we mentioned in the previous slide, the quantitative measures that we'll be using will be compared to these levels of complete and acceptable delivery to determine whether the program was implemented successfully. The qualitative methods that we use to assess participant satisfaction and facilitator perceptions, we're going to be reviewing those, identifying common themes, and reporting on that in the final report. So there are several strengths and limitations, I think, of this project. One of the biggest limitations is the scope. We had to make it somewhat limited due to the resources available within the department. It is a very small department with only 4 staff members, and they're tasked with a lot of day-to-day activities, and so the evaluation needed to be in a way that provided meaningful information but didn't put a significant burden of time on staff. It does rely somewhat heavily on self-administered questionnaires, which may introduce bias into the study if participants do not respond accurately. And lastly, again, there's no resources to hire an external evaluator. So there are benefits from using an internal evaluator, but it may introduce some bias with the facilitators also being responsible for the evaluation. One of the biggest strengths, I think, of this project was that I was able to spend the 3 months getting to know the department, and I was able to create the whole evaluation framework in a way that is very feasible for them to do on their own without any additional support. The framework provides all of the instructions that they need for the entire process, from data collection to storage to analysis. It does address an issue that's of significant concern in the community, and the public health department and the high school have a very strong relationship, so there is a good chance for expansion of the program should it be seen as suitable for this audience. In conclusion, the Craving Change program is just one approach to address problematic eating. The overall goal is that through implementing the program, it will lead to a decrease in the rate of diabetes and improve overall health outcomes in the community. The Public Health Department does plan to expand this program and offer it to the broader community over the summer and into the fall. So the results of this process evaluation will help them to determine whether it is appropriate to use this program with the students and youth in the community. And there are several people I'd like to thank for their support. I'd like to thank Victoria Barr, who is my practicum supervisor, Dr. Catherine Worthington, my first reader, and Dr. Michael Hayes, my second reader. I'd like to thank the Fort Smith Health and Social Services Authority, in particular Melanie Kearley, who was my supervisor on site, and the staff and students at PWK High School, where I was actually situated for my practicum. And that is the end.
Wonderful. I know. Got you guys trained well. Another one that was perfect timing, just saying. Is anybody from NWT watching on the webcast, do you know?
I'm not sure, actually. They were going to try, so hopefully.
Wonderful. Well, hello to NWT if you can see and hear us. You're very welcome, and it's a beautiful day here in Victoria.
Probably not there.
Questions? Nope, Victoria.
Thank you, Emily. That was a really good presentation. It was very clear and concise and beautiful logical flow. That's important. Can you just reflect a little bit? Some of the conversations you and I had during your practicum were about this sort of a program in the context of a broader approach to school health. Yeah. Can you talk a little bit about your experience with that and how you see this fitting in or not in terms of what they are able to do from a more comprehensive school health perspective?
Yeah, so one of the focuses of my practicum was on gaining kind of a better understanding of comprehensive school health strategies. The school that I was at currently has no health strategy, and actually I think the territory as a whole is a little bit behind with kind of implementing comprehensive school health strategies. One of the areas that I kind of touched on in my actual report was that there's a need for more comprehensive lifestyle approaches to addressing diabetes and the risk factors. So I think one part of my practicum, I was actually involved with the first meeting of the health committee, and they're starting to look at ways to work with different community organizations to develop a bit of a more comprehensive strategy and to see how that might look. Unfortunately, the school is kind of going through some major changes. They're losing 6 teaching positions in a school of about 20, so I'm not sure how comprehensive it will be in the near future, but I think, if this shows to be effective, it may lead to a more comprehensive approach, and hopefully that happens.
Oh. Okay, we got a couple of questions. I'll work my way down.
Thanks, that was a great presentation, and that was a hard question, so no hard questions for me, please. This one's easier. How did the students feel about this, or did you get a chance to discuss with the grade 9s about taking on this project, and what was their response?
So we have spoken specifically just with the teachers and administration at this point. The implementation plan is kind of set to start in June, and at that point they'll be going in and speaking with the students and with the classes more specifically. I did actually work, so my office was in the high school, so I did get a lot of interaction with the students, and I think they're excited for different programming. Yeah.
Hi, Emily.
Hello.
I'd like to ask just about the broader context question again, somewhat like Victoria, but this time around, the whole issue of food security and the cost of food in rural, remote, particularly northern communities. Could you comment on how that plays in with what is clearly an issue around body weights and related disease entities?
And that's actually one of my interests is a little bit in food security as well. And I think, even myself living in a small kind of remote area, the cost of food is unbelievable. You go to the grocery store and it's $100 for a bag of groceries. And I think there's definitely a need, and I know, there's always criticisms of the Northern food programs, and I think there's definitely a need to kind of, review those and look at ways that we're actually making the purchase of healthy food feasible and available. To me, that's one of the biggest issues is, it's expensive, but it's also just not available in the communities. So I think that's, there's definitely a need for more of a kind of a systematic look at the food security in the northern communities, and especially when you get further up north and when the costs are very high.
Thank you.